It's a report that shows the hard-hitting reality of HIV infections around the world. According to UNAIDS, 39 million people were living with HIV in 2022, bringing the total to more than 85 million people infected and 40 million deaths since the beginning of the epidemic. Among the hardest hit regions is sub-Saharan Africa, where 2/3 of all HIV-infected people live, and where the most affected country is South Africa. In Asia, the number of infections is on the rise in countries including China, Indonesia and the Philippines. A lack of sex education is partly to blame.
Misinformation and disinformation are still out there. Our culture tends to demonize sex versus the actual mode of transmission.
But according to UNAIDS, the outlook is promising, and the organisation says it is possible to end the AIDS epidemic by 2030. In some countries, including Botswana, Rwanda and Zimbabwe, infection rates are rapidly falling. Another advance is the growing availability of treatment. 30 million HIV-positive people now have access to treatment, compared with 7 million in 2010.
We know that there is a path to end AIDS. We are celebrating the fact that there's tremendous progress that we've seen in the global HIV response. AIDS deaths, for example, have decreased by nearly 70% since they peaked in the early 2000s. There are fewer new infections now than ever before.
But barriers to progress remain. Funding for the fight against AIDS is inadequate and decreased in 2022.